Hello, and welcome to the session about prematurity. Today we will talk about these subjects. What is prematurity? The signs of preterm labor. The signs that require immediate consultation. What to do in case of an emergency. Preterm labor is the term used to designate labor that starts too early, which means before 37 weeks of pregnancy. The objective is to reach 40 weeks, staying nice and warm in mommy's belly. The gestational age determines the baby's level of prematurity. The realities and experiences may be very different based on this level. The three categories of prematurity. A premature baby is born between 33 and 36 weeks. A very premature baby is born between 29 and 32 weeks. An extremely premature baby is born before 28 weeks of pregnancy. The premature baby is exposed to several problems, because it still lacks reserves and many of its functions are immature. Because of these numerous possible complications, a premature baby may be hospitalized at the neonatal unit of the CHUL for several weeks, if not months. If a premature baby is born between 35 and 36 weeks and is doing well, it will generally leave the hospital within the same time frame as a full-term baby. There are 5 broad clinical situations responsible for a delivery before 33 weeks. Hypertension and its complications. We are in the presence of hypertension when systolic blood pressure is higher than or equal to 140 mmHg and or the diastolic blood pressure is higher than or equal to 90 mmHg. Hemorrhages. Excessive bleeding endangers the mother and the child. Premature rupture of membranes. This occurs when the sac of amniotic fluid breaks before the baby reaches full term. Spontaneous preterm labor corresponds to the start of labor before the normal term of pregnancy. Intrauterine growth restriction corresponds to the birth weight that is too low for the gestational age. In general, the tests and examinations help determine if you have risk factors. If you are concerned, it is important that you talk to your physician or call Info Santé. Here are a few tips regarding your lifestyle habits to prevent preterm labor. These small actions can make a great difference in preventing prematurity. Vaginal bleeding. It is not normal to have vaginal bleeding after 14 weeks. You may have light bleeding after a gynecological examination because the cervix is more fragile during pregnancy. Abnormal vaginal discharge. Irritating with odor and a color other than clear or whitish. Urinary problems. Pain or burning sensation when urinating. More concentrated, darker and limited urine. Continuous vomiting. Excessive weight gain in a few days. Swollen face, hands and feet when you wake up. Not feeling your baby move for a few hours. Sometimes you may not feel your baby move because you were more active or distracted than usual. After 26 weeks of pregnancy, if you do not feel your baby move, or if it moves less than usual, rest and observe what happens. If you count fewer than 6 distinct movements during a 2-hour period, consult your physician. Intense and continuous headaches. Vision problems or low or blurred vision. Seeing black dots or bursts of light. Buzzing in the ears or dizziness. Acute bar-shaped pain below the breasts. Fever and shivers. If you have fever with a temperature between 38 and 38.4 degrees Celsius and a good general condition, you can wait and see how your situation progresses. You can take acetaminophen to lower your temperature and relieve the pain. However, consult a physician or the professional who follows your pregnancy if your temperature between 38 and 38.4 degrees Celsius persists for more than 24 hours. Your temperature is 38.5 degrees Celsius or higher. You do not feel well or have other concerns. Early contractions. It is sometimes possible to stop early labor if you consult quickly. Take time to look at what you can do in case of an emergency. Ultimately, all parents want a healthy baby, but even in the best conditions, everything does not always go as planned. In this situation, you may feel overwhelmed, and the healthcare environment may seem intimidating and incomprehensible. Give yourself some time. You are adjusting to a role that is very different from what you imagined. Ask your questions. Do not hesitate to ask questions on your baby's health condition concerning the care and the treatment he or she receives. Ask the healthcare staff for a moment to discuss these concerns and find out when the physician most often visits. Ask for help. If possible, ask your family and your loved ones to help you. For example, by taking care of household chores, by taking care of your other children, or by helping you with the baby. Do not hesitate to ask for psychological support if you feel the need to. There are social workers and psychologists who can help you in several specialized healthcare teams. Ask about the available resources. Your hospital's specialized healthcare team will be able to inform you about help that is available to you. Do not hesitate to ask for help to touch your baby in the incubator, to hold your baby in your arms, or to have skin-to-skin contact with your baby while covering your baby with a blanket. Your baby feels your presence, and that helps him or her. If you cannot take your baby out of the incubator, check if you can put a scarf or a piece of clothing with your scent beside him or her. Remember that nothing and that no one can replace mommy and daddy. For any questions regarding the content of these prenatal capsules, you can contact your region's perinatality nurse.